Hi everybody! Hi everybody! This is Dr. Vania Martins, your Brazilian British gynecologist in London. Today I want to talk to you about bleeding after intercourse or bleeding after having sex. Okay, it is a very serious red flag in women's health or in gynecology. Why? Because it might be cause of some diseases such as problem in the cervical canal, like let me show the uterus, okay? So you can have here, this is the cervix, okay? Show you here, the cervix, here, okay? So if when you have intercourse, usually the penis of your partner reaches here. If it bleeds because might be infection here or might be what you call ectropium, okay? And then it bleeds. Okay, so it is a very serious red flag in gynecology. So if you are bleeding after sex, okay, or day after sex, you should look for help. Bleeding after sex sometimes is followed by lower pelvic pain to pass urine, offensive discharge that you didn't have it before. Sometimes the bleeding after sex is not very red like wine. It might be brown, okay? The quantity does not have to be very high quantity of bleeding after sex. Any bleeding after intercourse should be investigated. It is called red flag in gynecology, okay? It's very common issue in England, okay, because I'm a gynecologist here in England. I work in London, and usually have these cases here. Okay, so we have to investigate these patients. It's common if in young ladies, middle-aged ladies, or even women after menopause. Of course, the causes might be different causes. A young lady might be one reason, for example, HPV virus, that one that causes cervical cancer, or might be a sexuality transmitted disease. In a middle-aged woman might be maybe a polyp. In a women after menopause might be because she has no good amount of lubrication or because she's in menopause. Okay, so the causes might be different. Okay, but definitely it must be investigated. Okay, another point and the last point, how you can give the diagnosis of causes of bleeding after sex. So you need to see a proper gynecologist. He needs to check you inside. Okay, you need to lie in bed. He needs to check the cervix, the cervical area. That's area here. Okay, he needs to see the cervix and see if there is any issues in the cervix that might cause in the problem. See if you have any kinds of infections, or if there is nothing in the cervix, you might need to have other exams to investigate. The advice is if you are having bleeding after sex, you need you need to look for help. Okay, this was your Brazilian British gynecologist in London. My name is Dr. Vania Martins. We have a page on YouTube called Vania Healthcare. We have loads of more videos for you there, and you can go there and have a look. Okay, and subscribe in our channel on YouTube called Vania Healthcare. I see you next time with another hot topic. Bye bye.